So welcome back. I have the great privilege and honor to be sharing the stage with Dr. Hector Lopez. And we're going to talk about a couple things. But really, it's going to be nutritional strategies to optimize player performance and longevity. And we're actually going to kind of span a lot of different topics within that. But this is going to be kind of the core chunk of it. Hector, if you want to give a brief background on yourself.
Yeah, thanks, Taylor. Thanks to Wayne and State Space and Taylor for the invitation. It's a real honor to be here. So a little bit about my background. So I'm a physician. Spine and sports medicine, physical medicine, rehabilitation was my specialty. But even before medical school, my first love was really trying to tie nutritional biochemistry or nutrition to human performance. So how do the best athletes, the highest performing athletes in the world, end up doing what they do, and how do you make good athletes better? How do you make better athletes elite using nutritional strategies? So THR Biosciences, one of the companies that I'm a co-founder of, that's basically an innovation engine where we try to screen and use computational discovery and artificial intelligence to look for new ingredients or new bioactive compounds that are found, that are naturally occurring in nature. And then how do we bring some of those compounds safely and effectively to the market? Center for Applied Health Sciences is a CRO, or a contract clinical research organization. So we're basically a privately held research organization that does human clinical research, mostly focused on nutrition, on dietary supplements, on medical foods, functional foods, and beverages, in order to look for validating safety and efficacy in products that are looking to make claims. And then finally, Supplement Safety Solutions. We're a regulatory compliance company. We help to make the responsible brands or companies in the dietary supplement industry, functional foods and beverage industry, we make sure that they stay within the guidelines of the FDA, and we look for safety, post-market safety surveillance. Are there any adverse events that are associated with these products on the market? And so we usually end up doing a lot of that work for many of the brands in the industry. So.
Awesome. So my background's in athletic performance, coaching college in the NFL for 10 years, and 3 years ago pivoted into esports, and I haven't looked back since. And one of the common threads that continues to come up both in traditional sports and very much so in esports is this idea about supplementation and nutrition and both the pros and cons about that. So I'm super excited that we could dive into this today and explore a little bit of kind of the big picture, then drill down a bit as well. So the key points is we're going to talk about load management and just stress in general because it needs to be talked about, right? We talked earlier on these presentations and the panels about load and cognitive stress and load and what that means. And then also Hector's going to talk about the micro and macronutrients, and then let's get curious, let's ask questions, let's try to discover about and learn more about the supplementation industry so that we could better equip ourselves with more knowledge to make better informed choices. You want to drop into the slide?
Yeah, sure. So I think we've seen a very similar slide like this before. It's very common, it's a common theme. It's basically the integration of all these factors that can all impact human performance. And that's human performance in any endeavor, whether you're on the field, in the gym, on the court, in a ring, for combat sports, combat athletes, or of course, even if you're an esports athlete or a gamer. All of these factors tend to play a role ultimately in the outcome and the performance, as well as player longevity, which we'll get into a little bit as well.
Yeah, I think long-term player and skill development is incredibly important. And so like when Hobie talked about it earlier with this holistic model, I mean, there's a lot going on. It's incredibly complex, yet we don't need to make it complicated. Okay, so things are inherently complex, but we don't need to make them complicated. So what that means is when you start to look at them as groups of systems, it becomes a little bit more digestible in understanding what's going on. So first, before we get into that, let's just kind of talk about this model here. So this is allostatic load. So allostatic load is essentially, everything is stress, right? We tend to think of stress being physical or cognitive, but recovery is stressful. Even the food we eat can be stressful depending on if we have food insensitivities or allergies. So everything can be considered stress, right? So if you look at these major life events, environmental, trauma, abuse, all of this kind of gets factored in. Then we also have individual differences, behavioral responses, and really perceive stress. A lot of times stress, we do it to ourselves. Like how many times do we have a conversation with ourselves and become our own worst critic? And that becomes stressful, and then we kick in this physiological response. But really, we look at this, our bodies are highly adaptable, right? So we say long-term player development and understanding that we are adaptable human beings. So allostasis is this mode of adaptation. And you can actually look at this curve of, we get really good at adapting to the stressors we placed on ourselves, but sometimes too much so where we almost go off the cliff and break, which is, at that point, it's obviously too far.
Yeah, I think we've heard a lot today about, probably just about almost every panel, we've heard burnout. I mean, that's something that really jumped out at me, at least sitting in the audience throughout the day. And, really burnout is about managing distress, eustress, and stress resilience and adaptation. So it's really the balance between recovery and any cognitive load or cognitive stress, as well as lifestyle factors. How do you integrate a lot of these lifestyle factors that we've talked about in order to get people to be in that optimal zone, in that optimal peak performance zone? And that's something that's highly variable. It's very individual. So being able to measure maybe one player's on the team, their HRV and how they're responding, their heart rate variability and some of their parasympathetic nervous system, the sympathetic nervous system tone, and how they're responding to their particular recovery schedule or their strategies, that's all critical and important in terms of optimizing performance and longevity, both.
No doubt, and also the conversation, right? Sometimes the most powerful diagnostic tool is having a conversation and asking somebody, like, how are you doing today? And then if they give you an answer where you can tell they're just like totally BS, you're like, well, really, how are you doing today? Right? So it's engaging in that communication and understanding your players and meeting them where they're at. That's been a constant theme too, is meet them where they're at. And that becomes incredibly powerful. So now, backing up and talking about systems, this is like one of my favorite slides by our colleague, Dr. Jim Laval. I just love this. So basically, metabolic activation pathway. Again, everything up top, this is all stress, right? We tend to not think about all these other factors. So our diet, prescription drugs, exercise, so the type and the frequency, environmental exposures, genetics, psychological, physical stress, and disease. All of this gets kind of dumped into this system, and if you think about it, right at the center of it is our HPA axis. You want to touch a little bit on that?
Yeah, so the HPA axis is something that's probably part and parcel and critical for player burnout and responsible in large part for player burnout. Anytime the body senses a stress, even if it's a perceived stress or a real stress, it kicks off these pathways and these cascades. It starts in the hypothalamus, it travels down to the pituitary, and then eventually affects the way that the adrenal glands are responding to stress. So we heard earlier, I think, about cortisol levels being comparable to race car drivers, heart rates going up to 160, 180 beats per minute. But there's still a disconnect between being able to have that physiologic, that physical outflow versus just getting that perceived central activation. It's definitely a big metabolic activation pattern, but it's different in esports, of course, than it is in many of the other physical sports.
Definitely. And so if you notice, at the center of all of this is cortisol. That's our stress hormone, right? And the things that I'm always drawn towards is all of it really about looking at our brain function. So cortisol, our stress, and its impact on serotonin, which is going to have anxiety and nervousness, depression, food cravings. It's going to drop your melatonin. I mean, you're not going to be able to sleep as well. Okay, so and then after all that, you're going to have thyroid, insulin resistance. We talked a little bit about lean mass and fat mass and body composition, the implications on how that factors into player development and performance. And if you look, it's all connected. I think that's that's why I love this slide so much, because if you take a step back, you realize it's very much all connected. And if you kind of go to the root of it, oftentimes we try to fix, the symptom, but we got to go to the root and understand what's really going on, and that can be quite tricky. What's brilliant about what Jim did as well is with the metabolic triad. So the metabolic code is essentially his way of compartmentalizing these different topics. So he has these 5 triads. He has the adrenal, thyroid, pancreas. That's a system. Glute, immune, brain. That's another. Cardiopulmonary, neurovascular, lymph, liver, kidneys, and then estrogen, progesterone, testosterone. And so he'll do a blood panel. And from that blood panel, he basically compartmentalizes those five triads. And the top 2 that rank the highest, So you have your objective, and then also subjective questionnaire. So he overlaps the two, which is incredibly important. But the top two that rank the highest, he starts with those. And then once you work on those, what happens is the bottom three tend to sort themselves out, which is, I mean, I just think it's awesome.
And one of the things before you move on, so one of the things we get to do at our research center is we get to look at a lot of these dietary ingredients or finished products that have multiple ingredients on the market and look to see what effect that has on a lot of these biomarkers. So this, what happens is we're looking to see changes in the signature, the profile, the metabolic profile, how all these hormones and various cytokines and all these factors in the blood that we can analyze and assess, how do they change over time and how do they correlate to someone's stress resilience, to their adaptation, to their ability to get better despite this increased cognitive load or neural load.
Definitely.
So yeah, so pillars, I like to look at nutritional neuroscience, really, and looking at the three main pillars is macronutrients. So what are people doing from a macronutrient standpoint, which basically just means your background diet. You know, we've heard before about the importance of that being at the base earlier in the one of the panels. And so background diets want to make sure that players are covering their bases. So usually a well-supplemented Mediterranean-based diet or a hybrid of Mediterranean and MyPlate. Although I don't always agree with MyPlate, which is the most recent dietary guidelines, at least on the right-hand side. I do like the plant-based, making half of your plate plant-based, fruits and vegetables. The other half of grains and proteins, I think you need to be able to modify that a little bit depending on the player, depending on their background, depending on their particular stressors, their load, what's their schedule or their playing activity looking like. So those are things that can be activity dependent or stress load dependent. Micronutrients, of course, your standard multivitamins, vitamin mineral backgrounds. There are certain key minerals that are really important for neural health and nutritional neuroscience, things like magnesium, zinc, selenium on the mineral side. With micronutrients on the vitamin side, of course, your B vitamins, B12 status. Methylation status is an important one. And many people are walking around not realizing that they have a deficiency in one of the main enzymes that allows you to use folate or folic acid. So again, I think we're going to probably start seeing a lot more of this hybrid of personalized nutrition, personalized medicine, into esports player development and management as well, which is going to allow us to get to the root of that. Bioactive compounds, these are basically a lot of the compounds or molecules that are found within botanicals, plants, fruits, berries, vegetables, dairy products, mushrooms, medicinal mushrooms, or adaptogenic mushrooms. Not those kinds of medicinal mushrooms. Although there's obviously a big health and wellness role there. There's a lot of research in that too. Yeah, and that's coming as well. And then there's also other bioactive compounds. We were fortunate enough to be the first privately held research center to do a study on hemp-derived CBD. It's a commercially available product. We actually ran a randomized controlled human clinical trial looking at safety and efficacy, and we have 3 more underway right now with other brands in the industry. So.
Awesome. So we're probably going to focus more on the micronutrients and the bioactive compounds for educational purposes, because a lot of the macronutrient stuff you can find. And that's pretty accessible, but really drilling down and understanding on a deeper level the micronutrients and the bioactive compounds, I think that's relevant for this conversation. So here's kind of a list of the micronutrients.
It's a busy slide, but I basically talked about this essentially. So, and this will be available if anyone wants to email me for the presentation, or email Taylor or I later on. So a big list of potential cognitive ingredients. And I know that there's some individuals who might be a little, looking at it with a squinty eye in terms of, well, is there any evidence behind any dietary supplements or ingredients that actually work? And the fact of the matter is, look, when I was a resident and a fellow doing wards, I was often, met with, well, there's really no evidence for that. Or there's no, anytime someone on rounds brought up a dietary supplement, there's just no evidence for that. And the fact of the matter is, they often just didn't look or weren't aware, but there is, in fact, and there's emerging evidence as well. thanks to many good research groups academically as well as in the private sector who are doing research. So I think you could look at this as if you're a product developer. Someone mentioned, I think, a couple of the brands out there. I don't want to necessarily name them by name, but there's brands out there that are targeting gamers, and they're targeting esports athletes. And a lot of these products, you pick them up, and it's like everything, you know, including the kitchen sink. And they just throw all these ingredients in a proprietary blend, so you don't know how many milligrams of any one ingredient is really driving the response, if in fact there's an effect. And so what I would say is if you're a product developer, this is sort of like, and you draw an analogy to an artist, this is sort of your color palette. These are some of the ingredients that many of the responsible brands have to work with. The issue is, are they dosing them in clinically effective doses? And are they in fact using branded ingredients that have a very reliable, secure quality assurance, quality control program in place so that you know you're not getting an adulterated product? And I know that this probably hasn't made its way yet into esports, but Taylor and I have been talking about the fact that, you know, there's NSF for sport certified, there's Banned Substance Control Group, there's Informed Choice, Informed Sport. These are organizations that certify products for athletes who are competing in tested organizations for banned substances, for performance-enhancing drugs. At some point, you know, in terms of leveling the playing field, that might be something that makes its way into esports if it hasn't already in certain organizations. So, do we want to pick out some of these?
I was going to say, are there any of those you just want to pick off?
Yeah, I mean, so obviously, I think a hot one that has just blasted the entire culture here in North America is the phytocannabinoid space, cannabis, hemp-derived versus actual marijuana-derived. So CBD or cannabidiol is one of the phytocannabinoids. It's very different from THC, of course. It does not bind to CB1 receptors, so therefore it doesn't have a psychotoxic or impairing effect. It doesn't make people high. But it does have other potential benefits. There is now also a pharmaceutically available prescription-only drug, and there are, of course, many products on the market now. The problem is that when there's a vacuum, it often gets filled with some unscrupulous players, some bad actors, and so I think it's important to, you know, be mindful of that. There are other cool ingredients here that actually have cognitive performance data to support them that could probably carry over into esports and gamers. The issue I have is that they haven't been conducted on a gamer population yet, right? So they may have been conducted on individuals who have a clinical issue like mild cognitive impairment or dementia or even stroke. I know I did a study on creatine monohydrate. It's not on this list, but I did a study on creatine monohydrate about 18 years ago in chronic stroke patients. That's something that's mostly seen as a sports, power, strength, bodybuilding supplement even. But it has potential crossover or carryover into other areas, including cognitive function. I'll also bring out full disclosure. I do also own some IP, and Theacream and dynamine are ingredients that I do have a patent on, and we license into the industry. But we have done 8 human clinical trials on them. So I think some of the things you look at, Numentix, New Level, these are ingredients that have human clinical research to back them up. And that's certainly something that if you're ever asked by an esports athlete, a gamer, you know, what to look for, we're going to cover that a little bit as well. But you definitely want to, if possible, look for ingredients that have human clinical research and are evidence-based.
Definitely.
So does anyone know what this molecule is just by looking at it? I don't know if there's any chemistry wizards in the room. Any guesses?
Caffeine. I was drinking a lot of it today.
Yeah, we've all probably had some today, or at least.
So I think a big topic that comes up that I've seen in esports, I mean, actually in all athletic endeavors really, is like caffeine consumption. And really understanding the pros and cons of caffeine and the habituation and really if we kind of, I won't go back to the slides, but really understanding the impacts it has on our HPA axis and their stress response over time. So if you want to just touch on kind of caffeine itself, and then we kind of dive into some of the mechanisms behind it.
Yeah, listen, I mean, I think it's no surprise. Caffeine is essentially the #1 consumed drug molecule in the world. I think it often gets a little bit of a bad rap because it tends to be pretty easy to develop dependency, tolerance, something known as habituation or tachyphylaxis, which basically means that after about 5 to 7 days of consuming caffeine at a certain dose, you actually reach a habituation where you get desensitized. And now just for you to get back to baseline, to operating at your baseline level, you need to get back to that dose. So if you go a day or 2 days without that caffeine dose after a week, then you're now operating below your baseline. But in acute settings at a certain dose, it has reliable data to improve performance. It improves performance in endurance and even certain cognitive functions, selective attention, simple reaction time. But I think when it comes to esports and gaming, you want something that's a little more nuanced than just simple reaction time, because simple reaction time may go up, but your error rate may also go up in conjunction with that. And so I think that's where it becomes important to get a little more sophisticated with product development beyond just driving caffeine into these products.
Yep.
Yeah, so Theacream is one of the ingredients, again, that I have a patent on. It actually looks very similar to caffeine, but it actually is something known as a methyl urate compound instead of a methylxanthine. Basically what happens is it interacts with receptors differently than caffeine, so it doesn't increase blood pressure, heart rate, and it also doesn't have that habituation effect, which means a 100th dose is as good as your first dose.
So basically you don't have to take as much, and also with caffeine as well, which is super important. So yeah,
the endocannabinoid system, so I felt that it's important to at least just talk about, this is the system that everyone in the cannabis space is trying to target. The endocannabinoid system is a system that really didn't get much attention, even in my medical training. In the medical biochemistry and molecular biology, we didn't really do much on endocannabinoid system, but it's a very important system, and it talks to so many different organs in the body. So it's definitely a system that modulates or regulates in some way, shape, or form the way that we eat, sleep, relax, forget. And you're thinking about forget. Well, why do we want to forget? Well, this is kind of functional forgetfulness, right? If you have a very traumatic experience, that's an experience you probably want to forget. Otherwise, if you relive that painful or traumatic experience, then you end up potentially developing some pathology like PTSD, post-traumatic stress, and it can just get in the way of quality of life. And then protection, so it's basically helps protect your body from some of the mechanisms of stress that we were talking about before in load.
So we've got 5 minutes left.
Yep.
You want to roll through a couple more slides and take some questions?
I think we should, just roll through and take some questions possibly. So this is just more background on the endocannabinoid system. It's basically the system that helps us to get ready for and recover for the hunt or the stressful events that we talked about. And that's why we're all affecting the endocannabinoid system in one way, shape, or form. Whether you're consuming cannabis or not, we're affecting the system. So I think we could just jump through. Yeah, this is more background on the on CBD. So there are many other cannabinoids in the cannabis plant. CBD's been getting a lot of the attention. Of course, THC are the two major ones, but there are over 100 different phytocannabinoids. So over the next 10 to 15 years, you're going to be seeing many other minor cannabinoids start making their way onto the market for different health purposes. Yeah, I think we can roll through,
Yeah, so this is a good
one.
So I think this is something really important to consider, and oftentimes, like I didn't know this until Hector and I started talking, is how to look at these different ingredients and use that information to make better informed decisions.
Yeah, I think I've alluded to it throughout the presentation, looking for clinically studied ingredients, so you get also batch-to-batch reliability, branded ingredients that also have that quality assurance, quality control, making sure that dosing are at levels that are sufficient to actually drive the response to make it effective and safe, utilizing bioactive ingredients that go beyond caffeine as your only driver of performance, formulations that prevent the habituation, desensitization, like I spoke about before. And then even this supporting neuro recovery, neuro resilience or restoration. So think of your esports gaming sessions and practice sessions as an athletic event. And just as high-level athletes have a pre-game or a pre-event or pre-workout supplement, you can look at this as pre-workout supplement and then post-workout for recovery. So I think we're going to get more sophisticated in the years to come.
Definitely on the neural recovery side, for sure.
Yeah.
Awesome.
Could we take one question?
Any questions? Yes.
So, I had a question. So, since the majority of the gamers that you're marketing this to, I know you had a slide in the beginning about the endocrine system, the cortisol, the testosterone. Since many of your up-and-coming gamers, your collegiate, your high school athletes, are male gamers or males that are going to go through puberty and their cortisol levels are going to go up and their testosterone is going to go up, their flight or fright response is going to trigger for no reason. And are you guys looking at maybe having a specific supplement just for them, for that, to cover that, or see what happens?
So the question is supplementation based upon the age
Demographics.
and demographic as they're coming up.
I think that's a great point. That's an important point. I don't think the industry is looking yet at age-specific demographics. It gets a little tricky in terms of, from a clinical research standpoint, being able to get approval for running trials on anyone under the age of 18, as you can imagine. But it's not impossible. We've done a couple of medical nutrition studies in pediatric populations, but I think that's important, especially in this space. So because of the age demographic being skewed and there being such a young demographic in this space.
Yes.
For aspiring gamers, those who want to go pro, and those who don't have the benefit of a dedicated nutritionist, a dietitian, you mentioned earlier about building your diet around the stresses you're dealing with, changing it up frequently. What are some suggestions you can offer them, or possible resources that are easily accessible to them that they can follow to kind of perform that function?
Yeah.
Yeah, that's
So,
to start
so
with.
the question is for aspiring pros who don't have the resources of a professional team, where can you get these resources? Kate with 1HP, they put out phenomenal information regarding the physical side as well as the health and wellness stuff. Great place to start there. Google is fantastic for just general information. And I think what I've always told my athletes, both in traditional sports and in gaming, is you got to find your BAMs. Okay, so that's your bare ass minimum. Like, what is the bare ass minimum that you could do every day that if you do that, that's a win? And for some, you can stack those up. It becomes a habit that then turns into a lifestyle change. But flipping it all the way back, I mean, if you could just wake up and say, hey, for the next 2 weeks, I'm going to drink more water, and start with that. That's pretty good. And then once you build that consistency, then you can say, okay, well, I'm going to start to get more vegetables in my diet. Even if that's getting some frozen peas and it's starting small. And I think a lot of that has to do with just understanding that it could be small incremental steps. It doesn't have to be a complete overhaul overnight. I think that's where a lot of people get tripped up. I mean, no knock on CrossFit, but a lot of CrossFit gyms tend to injure people quite quickly because they do too much too soon too often. And I think, again, if we look to traditional sports as a model of what to do, but more importantly, what not to do, we could say, okay, well, what are some big lessons learned? And what can we pull from that? And not make it simpler, but make it simple and accessible as a foundation to start building these habits and then turn into a lifestyle change. Yeah. Does that make sense?
Yeah.
I would also add that looking for like nonprofit academic organizations, there was one that just actually started up last month called the Society for Neurosports. And so again, what better neurosport to think of than gaming? And they basically try to bridge the gap between nutrition and performance, sports science, and neuroscience. And then there's also the International Society for Sports Nutrition. And those are good organizations that are academic-based, and they provide some guidelines that are free of charge. So, yeah.
Awesome. And that's it. Thank you so much. Appreciate it.